And I have testified in far too many court cases where one parent has tried to use vaccination as a child abuse issue against the other parent so that they don't have to pay child support.
That happened with Charlie Sheen. Denise, and I know you know Charlie, you've talked to him.
Yep.
Denise Richards, in the divorce, and then in trying to take him away so he couldn't see him, said he believes 9/11 was an inside job, and he believes vaccines might hurt his girls, when it's on record that vaccines have damaged incredible amounts of people.
Absolutely. So I sort of tell people that before you go to the hospital to have a baby, you need to know what you want to do about the hepatitis B vaccine, the vitamin K shot, all of those things. But I think it really should start before that. And I actually have a friend in Cleveland who's a nurse midwife that she will not accept a client as a client unless both the mother and the father are in agreement about vaccination.
What's your view on the vitamin K?
I think that there are a lot of reasons to put that off. The vitamin K shot was actually put into play in the hospital, ostensibly because of blood disorders and because of the very, very remote risk of bleeding that can happen in the brain if you don't have vitamin K on board. But vitamin K starts to be developed in the neonatal liver at about 7 days. And the vitamin K shot was also instituted because of circumcision. The circumcision was always done at 7 to 8 days. It was, a Jewish tradition, and that they did it at 7 days. When they started doing the circumcision in the hospital on day 2 and 3, the baby hadn't already been producing enough vitamin K in their liver so that there would be bleeding. So
isn't it amazing that the rabbis knew thousands of years ago to do it on 7 days when they had blood clotting?
Exactly.
How did they know that?
I don't know how they knew that, but they did. I don't know. It was just a tradition. I mean, there's a lot of things. I mean, how do we know from years ago? I don't know how to answer that.
That's amazing. Let's get into Ukraine and also the adverse reaction reports. This Washington Redskins cheerleader, she went to Johns Hopkins, other facilities. They said, yes, you've gotten this neurological disorder. The FDA said, yes, this can happen. And then she went and got some treatments and is getting better. I know Dale Dudley, 93.7 talk show host, he took a flu shot and months later got numb in his hands and feet, started getting paralyzed, started having trouble walking. He went to a bunch of specialists and medical doctors said, you had a bad vaccine reaction. He got better. Now they're trying to say it's a hoax because she got better, but the FDA itself says, don't worry, if you do have a neurological problem, most of the time it gets better. But they're trying to have it both ways, saying, well, because Desiree is getting better, it must be fake. But then there's all these other reports where they're admitting it's causing neurological problems.
Yeah, it's always amazing, isn't it, that if you get sick and you haven't been vaccinated, it's because you weren't vaccinated. But if you had a vaccine and you have a bad reaction, it's never the vaccine. I mean, talk about having it both ways. And it's amazing that even though conventional medicine completely failed this woman and had nothing to offer her, and then she goes and finds a physician, who is actually Dr. Buttar is a friend of mine, and they went to his clinic and they find out that there's some things in an alternative medicine arena that can be done. And she starts to get better. Now it was a hoax. She was misdiagnosed. It couldn't possibly work because their particular tools didn't work means that there aren't any tools that work. That is very, very bad.
What is Dr. Buttar and others, because he helped Jenny McCarthy and many others, they're trying to, as Dr. Blaylock says, reduce the autoimmune inflammation. They're trying to chelate and remove the metals. What are these treatments?
I'm not exactly sure. I know that there's a lot of IV treatments that are involved, and I know it's a lot of what you said. I think there's a lot of IV vitamin C, probably glutathione, probably different types of things that pull the metals out of the body. But it's all about rebalancing the physiology and putting the right biochemistry in and interceding quickly so that you can stop those inflammatory molecules from causing damage.
And instead of them admitting vaccines are causing a lot of this and giving people treatments when they give their 18-month-old the third round of shots, they have a convulsion, never talk again. Instead of rushing them in and saying, detox, detox, oh, no, it wasn't the shot, there's no treatment. You must have shaken your baby.
Yeah, and the other piece of that, they're always talking about how much the vaccine programs cost. There's a cost that has never really been analyzed, Alex, that I think is really important, and you've addressed it, is the fact that if you have a bad reaction and you go to the doctor's office, now what do? They put you through all of these tests, and I'll give you one quick example. For example, the hepatitis B vaccine that happens that they give babies in the hospital. One of the side effects right on the package insert is that babies can get reflux. They can get GERD. So now they start having GERD and maybe bad diarrhea. They take them to the pediatrician. What do? Upper GIs, lower GIs, endoscopy. They do CAT scans. They do all these different antibiotics, all these different things to this baby rather than going, oh, here it says right here on the package insert, this is a side effect, probably just a side effect of the vaccine. All of those costs, thousands and thousands and thousands of dollars of inconclusive tests, multiply that times thousands and thousands of patients. That is also a cost to the vaccine system, about vaccines.
Well, I've talked to old pediatricians that saw kids 50 years ago. They say babies are different today. Something's wrong with them. I mean, they got dull eyes. They're getting brain damage.
But it starts before babies.
Stay right there. We're coming back. Dr. Sherri Tenpenny is our guest in studio. A lot of ground to cover in a short time. Ukraine, you said at the start of the interview, and then we got cut off by the break, that you're really concerned about what's happening over there, that they may be getting ready to release something else. They may have released something, that this huge buildup in and around a medical emergency is really perfect for the establishment, especially with the economic collapse, this global realignment, what's happening with the dollar. Please continue.
I'm just concerned that there's another virus that's come into play. Because when you look at those numbers, if you can believe them at all, and there was a couple of really good sites that I looked at the numbers and how exponentially that there was more and more people getting sick in a very short period of time. I mean, was it something in the air? Was it something that was released? Was it one of these mutant viruses that we talked about in terms of Tamiflu? That now maybe the H1N1 and the H5N1 and maybe one of these mutant viruses has started to reassort, and that there is really something a lot more virulent that's going on.
Because with their supercomputers, they know how it's going to mutate in enough of a population. They admit that the nasal was live and could mutate and be spread. Why did they put out the first H1N1 vaccine nasal?
Well, I think that was more for convenience. I think that was kind of an easy thing to do, but it really does spread around in the population.
What do we know about this virus in Ukraine? I mean, is it a flu virus? What is it?
Nobody seems to know.
They just say, oh, it's killing people.
Exactly. And the World Health Organization sent a bunch of people down there that they ostensibly said, oh, it's just the H1N1 virus. It's just the novel one we've been talking about, nothing to be concerned about. But that is not the way that virus has behaved over the course of the last 8 months. You know, when we see the reports coming out of the Southern Hemisphere, we didn't have the exponentially number of people getting sick in a very short period of time. So I think that there's something else that's happening there that I think there's still some missing pieces, but I'm sure it's a story that'll evolve.
Well, that's what happened in January is we had emergency managers in Indiana, New York. I got internal secret documents that were later confirmed in New York where they were telling cemeteries, get ready for millions dead. That was in January, March, January, February, March. And I went on air and I said, they're coming with some type of big flu hype. I don't know if it's going to be real. It may just be hype, but they're really building up like we've never seen. And we never saw flu pandemics coming this quickly. Now they're coming in shorter and shorter increments, aren't they?
You know, Alex, I have a document on my computer that was from 2003 that was released. It was a small little report that came out from the CIA that actually said that they were very concerned that there was going to be the development of a virus down the road that could be activated by a second virus, and that there would be no way, and there was in a bioterrorism website, and they had no way of knowing, and there would be no way to be able to control that if there was a virus that had been released and then a second virus would activate it, and it may be even activated by taking aspirin. I'll get you that report because it was just a small little report. I stumbled across it on my computer the other day.
Why does aspirin activate so many things?
I don't really know. I think it really has to do with the way that it interferes with the cytokine reactions. But it really has, it causes all sorts of reactions into the bloodstream. But you know this, that if aspirin was developed today, it would not be an over-the-counter drug. I mean, it would be a prescription because of how many different effects it has on the body.
Some good, some bad.
Some good, some bad. Mostly bad.
Well, that's incredible because they admit Tamiflu has all these bad reactions and is highly restricted in Japan. Mm-hmm. They're just giving it to everybody like it's candy. And just like antibiotics make bacteria mutate quicker, I guess in a layman's terms, that's what these antivirals do.
Absolutely. And the World Health Organization talks about this. I mean, every month they come out with reports that there is now an H1N1 a virus that has been identified in a particular country like South Vietnam or Thailand or China or places that it's resistant. They know that last year the H1N1 strain in the seasonal flu virus was 100% resistant to Tamiflu. Well, that had to have happened because we used a lot of Tamiflu previous to that. So it's going to happen. I mean, it has to happen that these viruses are going to mutate and morph around. You can't be fooling with Mother Nature like we do and not expect to have a bad outcome.
Okay, I've been asking a lot of the questions. When we come back before we take calls, whatever you think is most important, I'd like you to speak about. And then also, again, the victory of the fact that people are waking up to this push for forced inoculation, this huge brainwashing campaign. So that's positive. But also on the negative side, the fact that the government would try to push this globally and the UN is in control of the situation, that's scary.
It's very scary. It's very frightening. And people really, it's so good, Alex, that we're able to talk about things like this. It's so good that people are taking an active role in investigating for themselves and just saying no.